Okay, so we are live.
Hi, I am Dr. Abhishek, and I'm a
Let
confident.
me introduce.
Okay, introduce.
Good morning, everyone. Today's session is going to be really helpful and it is led by Dr. Abhishek Roy from Apollo Cradle and Children's Hospital. He's going to talk about how to care for newborn. So stick around until the end and ask us question if you have any. Doctor, you have the stage now. You can.
Yeah, thank you very much. So today I'm going to discuss with you how to take care a newborn baby. So once a newborn comes, we all are very happy and excited. So at the same time, we need to know how to take care of this newborn baby, right? So the first and foremost is the establishment of bond with the baby. So immediately after the birth, we should breastfeed the baby and skin to skin contact should be there so that a kind of bonding is there with the mother. So breastfeeding, I would say, is the foremost, the most important thing. So every 2 hourly you have to feed your baby. Even before, if the baby is asking, you need to feed your baby. So a newborn baby has, a long sleeping cycle. They sleep around 16 to 20 hours a day. But you need to awake the baby and offer the feed, right? And we don't want the baby to, is not getting feed for, 3 or 4 hours. So this is not good, right? So every 2 hourly you have to feed your baby. Even if the baby is asking the feed before, you need to do that and ensure that the baby has a good, good urine frequency. So if the baby is feeding well, the urine frequency is good. So it should be at least 6 to 8 times in a 24 hour span. Okay, so after 1 or 2 days, the frequency you can watch the frequency at home. You can use cotton nappies at home. So you can easily see how many times the baby is passing urines. Right. The stool frequency is very erratic, so it can be right from 0 times to multiple times. So you may see that the baby may pass, the stool, that is little liquid in consistency. So it can be with every feed, right? And sometimes there may be even days, when the frequency is, even once a day or sometimes maybe once in 2 or 3 days. So this is also fine. So the stool is very erratic frequency, but the urine frequency should be good. So we know that, the baby is feeding well, right? So other important aspect about a newborn care is prevention of infection, right? So urine, the newborn baby doesn't have immunity as such, right? So we have to protect the baby, right, from infection. So we have to protect ourselves first. So any kind of viral infection is there, you should be away from the baby. Parents are having some kind of URA, upper respiratory infection, wear mask, do hand wash on regular basis, use hand sanitizers. So very important about this. So infection has to be prevented. So this is another important aspect. Apart from that, there's one issue of jaundice. So that is, we have to see for jaundice. So every newborn baby has jaundice. So we have to see how this jaundice progresses. So natural course of jaundice in a term baby, in a term gestation baby, is that it increases from 48 hours and gradually rises over a period of next 5 to 7 days, and then gradually comes down of its own. Sometimes this jaundice can rise above its range. So we need to see that. So as a pediatrician, we assess the risk factors and regularly follow up with the pediatrician. If you find that the baby's yellowish discoloration is there, you need to contact immediately. Because this jaundice is very easy to treat, but if left untreated and if the jaundice goes very high, it's very detrimental. It can cause serious neurological issues. So we need to see for the jaundice. So there are two myths for jaundice. One is regarding the sunlight, and other is regarding the mother's food. So both of them are big myths. So there's no role of sunlight as such in reducing the jaundice. So no need to take the baby outside to go to the terrace or in the garden for the sun bath is not needed. And the mother's milk, mother's food is not related with any kind of to jaundice. Okay, so mother can have anything in her diet, whatever her doctor recommends. Okay. So what helps in jaundice at home is a very good feeding. So you have to feed your baby very well. So if you feed your baby very well, so the jaundice will gradually come down of its own. So we have to be very careful in from day 2, day 3 to day 5, day 6. So this is the time when the jaundice progresses, and we need to intervene sometimes. right? So this jaundice part is there. Other important thing is regarding taking care of the cord. So this taking part of cord is very important because in newborns, about 15 to 20% of this neonatal infection can come from the cord. So cord has to be kept dry. Don't apply anything over it, and gradually over a period of 7 to 8 days, or maybe 5 to 10 days in a range, the cord gets dries off and it falls off itself. So once that cord area is completely neat and clean and dry, then you can bathe the baby and oil the baby. Okay, so before that, just do sponging and keep that area dry. Okay, so if you find any kind of redness or any kind of pus discharge, any kind of discharge from the stump, you need to immediately consult your doctor as soon as possible, because that can be a sign of infection over the cords. Okay, so just take care of the cords. For oiling, any kind of natural oil is okay. So like coconut oil or olive oil, whichever suits the baby's skin. So you can oil the baby once the cord falls off, and don't use any kind of cosmetic skin products. They're usually not recommended till 1 month of age. So after that you can use that. All the clothes should be washed, and don't use any kind of Dettol or Savlon in washing the clothes. Any kind of baby detergent, or you can use that. Any kind of detergents which are safer, which have less chemicals. You can use that in washing the clothes, right? So these is this regarding the taking care of this clothes. Other important aspect which we usually face is regarding the common symptoms like nasal blockage. So this is very common in newborns. So what they present is a kind of noisy breathing, and sometimes they have difficulty in feeding. Okay, so that time you can use simple saline nasal drops. They do help, and you can clean the nostrils, and baby will be comfortable. Okay, so these are the common things which you need to take care when the baby is small. Another issue which we commonly face is the issue of colics. So colics is also common in newborns. So usually around 2 weeks or 3 weeks you will find the baby having disturbed sleep patterns, and the tummy is little full, a little lot of posturing is there, and sometimes extremely irritable. So these colics do happen most of the babies, more or less. And again, these are all self-limiting. Gradually, they usually settle down with time, and you can tap a little bit, little bit of tummy time you can give, right? So if it doesn't settle down, then we can use some fennel oil drops. So they do help in colics. Okay, so with breastfeeding, these colics are usually very less. The formula fed babies, again, this colics are a little on the higher side. So always try for the breastfeeding. So this always helps, right? Now, few rashes also I forgot. So sometimes you can notice in the newborn babies there are few red spots over the over the face, over the skin. So sometimes these are normal skin rashes which are there in the newborn babies. So they come and go, and ultimately they'll go away in a few weeks of time. So you do not chase those rashes. But yes, if you use any kind of oil, and if you find there's after using that oil you get some rash over the body, then small rashes, then you can definitely stop the oiling for a few days, and then reapply. If you find the rashes reappear again, then definitely you need to change that oil, right? So this is regarding about this normal newborn rashes. And other things which you need to take care is you need not take the baby outside. Okay, only doctor visits, minimal people, uh, anyone having this cough and cold symptoms should be away from the baby. So we don't want any kind of infection, right? So three important parameters what we have discussed. One is feeding very well, proper with breastfeeding, okay, every 2 hours or before, and gradually when the baby grows up goes into demand feeding. Other important aspect is prevention of infection, so no infections for the baby. And third is maintenance of temperature. So temperature maintenance is other important aspect, right? So hypothermia is catastrophic. That is low temperature is catastrophic for the baby. So baby should be well wrapped. So extremities should be warm to touch. So you, with the back of your hand, you can touch the hands and feet and see that the baby is warm or not. At the same time, do not overcover as well. So overcovering, causes a lot of discomfort sweating. So it's also not needed. So just layer properly, cover the, uses cap and mittens you can use, keep the baby warm. Okay. So in the winters you can use heaters, oil heaters as well. So don't use it, very often. But yes, when you are changing the clothes, you can use those oil heaters. They are okay. Otherwise, normal heaters if you use, you can use little bit of water buckets to keep the moisture in that room. So keep the baby warm. So these three are the most important aspects. Okay, so if you do these things, gradually things will start getting better and better. So regularly follow with your pediatrician. So usually you should visit after 2 or 3 days, or as per advice of the pediatrician, again around 2 weeks, to see how the baby is doing. And thereafter, for regular vaccination, the baby should be visited. So how the baby is thriving, how the baby is gaining his milestones. So these things has to be seen. So now you can ask any kind of questions. I'm very happy to answer you. So there are no questions. Let me discuss something more about jaundice. So jaundice is, as I discussed, that jaundice is there in almost all the babies. So it is a natural antioxidant which God has given. So we see the jaundice. There are certain specific cutoff values. There are few charts of American Academy of Pediatrics. From there, we see the level of jaundice which has to be treated. So it depends upon the gestation. It depends upon when which gestation the baby was born. It depends upon what is the day of life of the baby, and also few other risk factors that needs to be seen. And according to that, we categorize the baby into the low risk or moderate risk, high risk, and from there we get to know about the jaundice level which needs to be treated. So treatment of jaundice is very simple, and phototherapy, that is special blue lights, are used to treat the phototherapy. Nowadays, these phototherapy units are very efficient, and they bring down the jaundice level very quickly. So treatment of jaundice is very simple if if we detect this treatable jaundice at very early stage. Because if this jaundice level rises to a certain extent, then we need to exchange transfusion. We need to do exchange transfusion again. So these things are much more complicated than this phototherapy. So early detection and treatment of jaundice if required needs to be done. So follow up with your doctor, and also watch at home for any excessive yellowish discoloration or anything such kind of things, right? Don't give anything apart from milk and vitamin D drops, vitamin D drops are routinely given, so that needs to be given till 1 year of age, so that your pediatrician will definitely prescribe you. Apart from that, no water, no good tea, nothing needs to be given, right? So milk, 87% is water, so water intake is from the milk itself, so nothing else is needed. So this will again prevent from infection. Okay, so this is another one aspect. Any questions? There are no questions yet. So we can discuss something more about feeding regarding the formula milk. So usually, you see, breast milk, as I told you, the breast milk is best for the baby, right? So it's most no other milk can match the breast milk. So sometimes breast milk is not, sometimes it's difficult. Maybe mother may have difficulty in breastfeeding, or there may be some other medical issues. Then the next best, what to use if there is no breast milk, then you can use this formula milk. So this formula milk has to be made in the right way, and the right way is you have to read the instruction of that. And usually it is 30 ml of lukewarm water and 1 tablespoon of the powder. So just read the instruction, and then you need to give it with a nifty cup or with a spoon. So no big no for the bottles. So bottle feeding is very easy. Risk of infection is very high. Okay, so use this spoon, and or you can, nifty cup is easy to clean, and the risk of infection is lesser. So formula milk then you can get if there is no breast milk available. Otherwise, the best for the baby is breast milk. So no other milk can match it. So nutrition as well as prevention of infection. So always try to try for breastfeeding, and it's very important that you bond with the baby, consult your lactation doctor, and if you have faced any kind of issues. So don't jump into formula feed in the one go and you start using the bottle. So once you start using a bottle, so baby gets so used to the bottle feeding, so it starts suckling. And bottle feeding is very easy to give, but at the same time, it's very difficult to do. So ultimately, what happens is that baby doesn't have any breast milk and completely close into bottle. So this is one major issue which is faced, which we see the most of the time. So any questions, anyone? There's no questions here. So if someone can connect or we can discuss. क्वेश्चन आ रहे हैं? नहीं, अभी तो कोई क्वेश्चंस नहीं है कोई भी। हाँ, पूछो कोई है तो तब तक हम चैट ऑफ। सर मैं आती हूँ पूछ के So one more common thing which which must be addressed is regarding the issue of reflux, the baby taking out milk. So 2 to 3 times is normal, right? So every baby takes out a little bit of milk. So it needs to be treated actively every time. And usually these refluxes are common, maybe around a week, around a month. So these refluxes can be there. So a significant reflux, how do we differentiate? So a reflux is very significant. If it causes some kind of life-threatening, like any kind of discoloration or any kind of such kind of symptoms, or there is a kind of failure to baby is not gaining proper weight, or it's not going well, then definitely this reflex needs to be actively addressed, and you need to visit your pediatrician for this, right? So these reflexes are much more more with this bottle fed babies. So this is one more reason you should try to avoid this and try for breastfeeding as much as possible. So these reflexes, need not to worry for these reflexes. So if it's not a significant one, it gradually go away with time. So nothing to worry for that. Anyone having any questions? Okay. So thank you very much.